Hi, my name's Sam Rikkers. I'm the Deputy Secretary and COO of WEDC. Today's conversation is the first in a series of 5 designed to help share some of the key questions and concerns that face business owners and leaders as vaccinations become widely available. At WEDC, we know that the state's economic health is inextricably tied to public health, and to help our businesses prepare for questions and concerns about how we can move forward from the pandemic, today's guests represent 2 resources that are absolutely incredible in Wisconsin. I'm really happy to introduce these 2 folks, Shirah Apple, a representative of the Small Business Administration, and Dr. Jon Meiman. Dr. Meiman is the Chief Medical Officer with the Wisconsin Department of Health Services. I'd love if you would both take a minute, perhaps starting with you, Dr. Meiman, just to briefly introduce yourself.
I am one of the Chief Medical Officers of the Department of Health Services. My day-to-day job is environmental and occupational health. So I work on all things that intersect between the public health domain and worker health. One of my big focuses has been on the risk of COVID-19 in the workplace and working both with workers and employees, but also with businesses of all sizes to help them kind of understand the risks in their workplace, mitigate those risks, enhance safety, move into vaccination, and really start to move ahead and get toward the end of this pandemic.
Great. Thanks a lot, Dr. Meiman. Shirah?
Hi, I'm Shirah Apple. I'm the Public Affairs Specialist with the U.S. Small Business Administration office here in Wisconsin. The mission of this SBA is to help small businesses start, grow, expand, and recover from adversity. And of course, for the past year plus now, we've been focused mostly on that disaster relief and recovery mission.
The SBA and DHS, Shirah and her team, Dr. Meiman, have absolutely been incredible partners with WEDC as we've dealt with the pandemic, as we've responded. And what's exciting about today's conversation is they're also partners as we really tackle coming around that corner. And so let's dig in. Dr. Meiman, can you start us off just giving us an understanding of the COVID vaccines and how Wisconsinites can access them?
Currently, there's 3 vaccines that have received emergency use authorization by the Food and Drug Administration, and all 3 of them are very, very highly effective. They're very effective at preventing you from getting sick, and most importantly, they're also very effective at preventing severe illness. So all 3 of the vaccines that are currently available, they're over 89% effective at preventing hospitalizations. And in the trials that they did, nobody died from COVID-19 who received the vaccine. So these are really life-saving interventions. The challenges early on with vaccine were really ones of supply. So we're really in a situation right now where we just need to kind of lower any kind of barriers between people, wanting the vaccine and getting the vaccine. Whatever we can do to make either that's addressing their concerns, providing them education, lowering any barriers they may have kind of logistically. And I think that's a place where employers can play a good role.
Great. I want to drill into something you just said, and this is something that Secretary Hughes has really underscored across this year, and our businesses certainly know of it, which is how much public health also affects the health of our economy. And so really digging into it, what you just talked about, tell us how getting our restaurants open, getting back to our favorite shops and our events sooner, what's the role that vaccinations play in that?
From just let's just say, start on kind of the manufacturing side, like the goods producing side, right? You need a really healthy workforce. You need people to feel comfortable coming into work so they can get there and produce the things that the state is good at and keep businesses open. On kind of the retail side, like you're saying, Sam, I think it's important for worker protection. It's also important for members of the public who come in and patronize these establishments so they can feel safe.
Yeah.
And so it's really about kind of bringing us all along together.
Great. Shirah, I want to turn it to you just for a minute and tell us a little bit. You said kind of a broad overarching view of what SBA does here in Wisconsin. What resources in particular do you provide, particularly as businesses are coming out of the pandemic?
Our partners in particular, they have been able to expand staffing thanks to some federal funding. We have 26 of those around the state. And they are on hand to sit down with business owners and talk to them and help them think through their individual situations. A number of the small business relief programs are still available via the SBA. So the Paycheck Protection Program, that was just extended until May 31st.
Well, that's great. I'm super glad that you took a moment to talk about your partnership with all the other service providers.
Yeah.
Across the state. Those are the building blocks for any business climbing back out of this pandemic. And you talked about those programs, the PPP program, there's also the EIDL. As you watched our state's economy and our state's businesses weather the pandemic, did you see a massive boost in demand for those programs? And what's happened to that boost now that vaccinations are on the rise?
So for PPP in Wisconsin, in 2021, we've seen about $3.9 billion flowing out now, but almost as many loans as there were in fiscal year 20. So we had 89,000 loans go out the door in 2020. So far this year, we've had almost 78,000 loans. So the loans are smaller, but they're getting to more businesses.
Yeah.
There's still PPP funding available, but it is steadily being used. So I would definitely encourage anyone who hasn't gotten one or who's gotten a first round loan and is thinking they want to maybe do a second one, to check their eligibility for that and go ahead and apply for it.
Now, as we're coming out of the pandemic, we're seeing at WEDC a real energy in our business community. I think businesses are feeling the opportunity ahead of us to really come back, as we're seeing even an uptick in some businesses. If I'm one of those businesses and I'm either already feeling or sensing in the near future an uptick and I am looking to expand, whether you are a restaurant that's bringing on workers again or a manufacturer that's seeing new growth, what type of programs would the SBA have to help me as I ramp back up?
It's definitely worth looking at the relief programs. I won't linger there, but it's worth looking to see what your eligibility might be. Our regular loan programs are available, the 7A and 504 program, which can cover basically any variety of small business capital that you need. The small business advising that I talked about already is there. And we would also, if someone has questions, they're welcome to contact our office at wisconsin@sba.gov. We do have folks that are speaking directly to business owners to help think things through. So those programs are still online and actually continued at almost a normal pace throughout 2020. Interestingly, our regular loan programs got regular use. And one big advantage of them right now is that there's a debt relief provision in place where if you get an SBA loan, then the SBA will pay your principal, interest, and fees. Yes, principal, interest, and fees for 3 months and potentially longer. So if you're thinking you want to expand, this is a very good time to look at SBA lending.
When I listen to you talk about that expansion, I feel a little bit my own sense of wanting to put this pandemic behind us. Unfortunately, I know there's still some work to do. And Dr. Meiman, does a workforce now who might even become vaccinated, maybe they've got their first or second shot in their arm, still need to abide by the rigorous safety precautions like sanitizing surfaces, hands, and spaces? Can you give us just a little bit of guidance of once we start getting vaccinations, what are the precautions we still need to kind of keep in mind, if any?
We're in a bit of a transition period, as you said. We've got cases that are starting to inch up a little bit. There are some concerns about the new variants of the virus that causes COVID-19. But on the hopeful side, we've got a lot of vaccine and we're being able to move it out very, very quickly, especially compared to a lot of other countries. So those are positive signs. Kind of in this period right now, I think it's very important while we're still vaccinating everybody to keep those protections in place. We really need a high proportion of the state to be vaccinated before we know we're really protected. We're doing a really excellent job and moving fast compared to other states. We still got a long ways to go there. So kind of in this transition period right now, I think to make sure that we keep those protections in place is going to be really important, because you can still have an outbreak in your workplace. That's still possible before everybody gets vaccinated. It's going to be very important to kind of keep those workers healthy, kind of keep those doors open. So things that we know work. We've had many months of experience now, doing what you can to improve ventilation in your workplace, making sure everybody stays masked, where possible, like we're doing right now. If you can work remotely and still do your job fine, that's a great option for businesses that can do that. Anything you can do to kind of keep people spaced out, those are all very important. And then of course, for some industries where people have to be in person and sometimes they have to be in larger groups, testing was really limited early on, but it's also a lot more available right now. And so from talking with some larger employers, they've really moved toward kind of regular testing, like we're starting to see in schools and we've seen in universities as well. So those things, making sure that you're doing regular testing, making sure people stay home when they're sick, masking, those are all going to be really important for the time being in the months ahead.
Dr. Meiman, that all sounds great, but all of those investments that businesses make, and gosh, they have just been incredible allies in this fight so far. They cost money and they require investment. So Shirah, back to you. As we are coming out of this pandemic and businesses are still investing in those safety precautions, whether it's equipment or the ventilation system that Dr. Meiman mentioned, are those type of investments that businesses are still making, still to deal with the public health issues before us? Are they things that SBA is still supporting as folks look to the SBA for support?
For folks that have the Paycheck Protection Program loan or are thinking of applying for it, the main purpose, of course, is to pay your staff, but one of the forgivable expenses under that is PPE and other similar protections that people need. And that's something that might be worth looking at our regular loan programs as well. Those business advisors can help you think about budgeting and planning.
Dr. Meiman, I know that the guidance that WDC and DHS worked on really provides some great guidance for employers. But as employers are looking at their role in really moving us out of the pandemic, what are the top recommendations you'd start with?
Yeah, I think it really boils down to three things. One is educating the workforce, making sure that workers have the information they need to make an informed decision about their health. The second is reducing any barriers to vaccination, whether that's providing a little paid time off to go get vaccinated at a community site. And the three is providing incentives where possible. Those have been shown to be helpful.
Dr. Meiman, Shirah, thank you so much for taking time to join us today. And for folks who've tuned in today, thanks for joining us as WDC continues to share and connect you to the resources that support businesses across Wisconsin. In our next forum, Vaccinations and Your Employees, we will share expertise from employment lawyers and human resource professionals. So until the next time, take care, and we'll see you shortly.